Heather Thompson, a clinical dietitian and clinical nutrition manager at WVU Medicine Uniontown for the past 22 years. My formal diagnosis was mitral valve prolapse that led to mitral annular disjunction. And that mitral annular disjunction causes the arrhythmias, which could be potentially very serious. So I started having palpitations that I noticed when I was pregnant about 15 years ago. I had had some testing done, but continued to follow up with cardiology over the years. And my symptoms started to become more intense, more frequent, more uncomfortable. She felt, it was reasonable to set me up with an electrophysiologist just to kind of get established for the future if I needed anything. I was set up with Dr. Schwartzman, the electrophysiologist, and he was wonderful. He wanted to set me up with a surgeon down at Ruby to get, his opinion on whether I needed to have mitral valve repaired. My first appointment with Dr. Badwar down in Morgantown was very nerve-wracking, high anxiety. You can imagine going from your yearly follow-up with the cardiologist in August or September to the surgeon's office February, March-ish, and them telling you needed to have heart surgery. And at 44 years old, I thought, this is scary. I have a 14-year-old daughter, a son that's in college, and still a young family, so it was kind of terrifying. But I had a really good experience. Dr. Schwartzman kind of wanted me high priority because of those arrhythmias. It was very smooth. I had an excellent experience from start to finish, from the admission staff to the pre-op nurses, and everybody made you feel very comfortable. And it went seamless. I finally got back to pre-op. They kind of got all my lines in and everything they needed to do, and off I went. And I can remember being wheeled into that OR, and I thought, wow, I really thought how incredible. What changed for me after surgery, as far as everyday life, would just be the increase in energy, I would think. Just those little things that you kind of take for granted. I was happy to have that back. I would say to anybody having concerns with their heart, or any issue for that matter, is to listen to your body and to advocate for yourself. There were times over the years that, my symptoms were shushed off as like anxiety, I'm high strung, I'm a woman. But those palpitations that I had and the chest pain were real to me, and they made me very anxious because I was scared. So, I just kept advocating for myself and following up with the people that I knew could and would help me.